But at the end of the day, the Supreme Court has ruled, and I think what might be a more interesting conversation for us to have is what are the implications on our generation and, you know, and on either the working professionals our age, the unemployed or the underemployed.
Absolutely, Randy. I agree. I mean, Sarah, I know you turned 26 this year. I don't know if you were continued to be on your parents' insurance or you're getting insurance through work, but you know, we hear stat after stat that, you know, in a couple years, half of all companies will have more. Or, I'm sorry, half of employees at a lot of companies are going to be, at Fortune 500 companies, are going to be freelance or temporary employees, and thus they don't have to get health insurance. So it is it's a big deal, and it's affecting a lot of us, a lot of our friends. So how do you think that it's going to ultimately be good or bad for 20-somethings, Randy?
Absolutely.
Oh, go.
If I can jump in here, I think that this is it's going to be extremely good. I'll give you an example. When I graduated college, you know, I had so many months to get a job and to own health care before I was off my parents' plan. Unfortunately, I was bouncing around from jobs, as we've described before, kind of trying to find my way. And I had to pay out of pocket an extremely astronomical rate, you know, considering that young people in their 20s are the most, you know, physically fit and healthy demographic, and thus cost the least amount to insure. Whereas, you know, if I like had pre-existing conditions or was a bit older, it would have been, you know, the same rate, but you know, justified because I did need all this care. But just to be safe, I had to pay, you know, out of pocket upwards of $200 a month, you know, going off and on. Some employers have made, you know, adjustments to plans to let these younger generations who are kind of, you know, living at home with their parents again, be back on their parents' plan. But going back and forth, you know, sometimes between jobs, oh, I need a month of health insurance. This is out of pocket so much. It's ridiculous. And if only there was, you know, a plan that I had, you know, for my whole life, I really wouldn't have to worry about this. And now a lot of employers are, you know, the job market's so bad they're not even offering benefits with jobs because they don't need to, and that's really scary. Or they're not offering, you know, spouse or children benefits because, you know, it's the insurance companies are charging them too much. You know, premiums have gone up, and I think that's a really scary situation.
That's my worry there. That's my worry. My worry about this is the cost. I mean, okay, I know I tend to bring this up every time, but I'm from New Zealand, and you know, in New Zealand, our healthcare is like we pay taxes, and the government looks after our accidental and emergency care. And basically, all of our healthcare is we do have public healthcare as well, but anyway.
And it works, does it not? It works.
It does, but okay, to go to that point, I was going to say something else, but to go to that point, I don't think that system would actually work in America because the health system's already too big and too, like, it's its own beast. But the thing that worries me about mandating like individual health insurance is that basically the cost is only going to go up. Like, let's be honest about it. The cost is only going to go up. And that cost isn't being controlled or regulated at all. I mean, this is just like, these are just companies. It's not like in New Zealand, you know, they play around with budgets and we can elect governments or, you know, boot governments out if we don't like what they're doing with spending and things. But with corporates, what control does anyone have over how they choose to spend their money?
So
or
Sarah,
how much they choose to charge for the services?
Yeah, so Sarah, that poses an interesting question to you, which is when you think about this ruling and, you know, part of what you saw as particularly advantageous was the cost savings that it might bring. But go back to your 21-year-old self who had just graduated college. Does this ruling put you in any different of a position?
Well, the thing is that I would have already been paying it my whole life, and, you know, it probably wouldn't have been a big adjustment. It would have just been something that my parents and I had budgeted for all along. So it wouldn't be a shock. It wouldn't be like, oh, now I have to buy health insurance. How about I've been paying it my whole life or through my taxes or through some sort of program?
Right. And what, so maybe it alleviates some sticker shock because it'll just become more habitual for certain people. But what about people who can't budget for that cost?
Right, and those people get health care and they don't pay for it anyway. So I think that point is moot because people who can't pay for healthcare can't pay for insurance, and should they have neither? No.
Well, that's where I get so lost, because as well as I say, it's hard to put all of your insurance needs in the hands of a corporation. It's really hard when if you need care, you need care. Doctors swear an oath to say that they're always going to provide care for their patients, always going to do their best to make sure they save you. It doesn't matter if you've just killed someone and whatever. Their goal is to save your life. And when you get money involved, it's so hard, and that's why I guess I'm so glad New Zealand has a system the way it does, because it doesn't really matter. Everyone gets the same health care. But it's such a problem here, because even the hospital you get taken to, you're going to get different care at.
Well, right. So, but taking it into the context of this country, I mean, in a lot of ways, and this is true, I think, of most countries, healthcare is a business, right? It's the same way, there are incentives to motivate people to go into the field, and that's sort of what helps produce, market-level competition the same way we would in any other industry.
The people who are making the most money in healthcare are not the ones treating people without insurance.
No, absolutely not. But I'm just saying, when we look at the industry as a whole, right, healthcare, it is a business, right? The insurance companies are in the business.
Insurance companies.
But should it be, Randy? Should it be?
But we could debate the should it be. Again, when we're looking at the effect that it has on our demographic, the reality of the system is it is a business. And right now the government is stepping in and saying we're going to regulate that business. And that's a very sort of anti-capitalist and also by extension anti-American attitude towards this system.
Right.
That's different from them regulating other businesses and regulating birth control.
Right, but this is exactly, the whole debate that we talk about often. And when I say there's an issue of states' rights here, it's an issue of the size of the federal government and whether or not this should be part of their territory. Right, for them to come in and say we're going to regulate this. The same way I don't think that they should be coming in and really regulating any other aspects of business. But that is sort of the way the system operates here. And that's what's troubling to me. But what's even more troubling to me is that I think that there's this sort of false hope about the ruling that's been spread. The change that it's going to have on us, people like us, people of our demographic, is probably not the change that I think a lot of people think that it's going to be. Sorry.
What is the alternative? What is the alternative? The healthcare is in such a dire situation that the government had to step in. If it was not as bad as it is, there wouldn't be a need for this. And that's why it's such a big platform for Obama, because it's huge.
Randy, can I ask a question?
Yeah, well, Randy, could you also explain, sorry to interrupt, Paul, but could you also explain the difference between what you think people think will come out of this and why you don't think it's as glamorous as people are thinking?
I think that people think that the idea of universal health care is going to be a low-cost, high-quality solution to all of our healthcare woes. And I don't necessarily think that that's the case, especially if what we're really regulating here is the need for insurance, right? Insurance, the cost is not going to go down. No measure of this plan really cuts costs on the insurance company and then ultimately on the beneficiaries of those policies. And I think that there's a good question and one that's come up a lot, which is, okay, so what is the alternative, Sarah, like what you just asked? That's really, the alternative in my mind is I pass that question back to you. We shouldn't put in a plan in place if we don't think it is the ideal solution, if we don't think it's actually going to solve this crisis. And where I'm struggling right now is I hear everyone talking about Obamacare, the impact that it's going to have. I don't really think that we're going to see any sort of measurable positive difference from this plan that's going to fix a lot of the troubles of the system that everyone was pointing to before.
Can I ask a question though, Randy? Because you mentioned that it's about individual choice, and I'm a bit of a fan of individual choice, I have to admit. But I sometimes think that there are things that people don't need to have a choice over, because even if you look at insurance plans, at the moment you don't really have much choice over them. If you're with an employer and they have a plan through X company, you're kind of, aren't you kind of stuck to that company?
No, I
have 3 or 4
choices, right? Sarah, were you just saying you have 3 choices?
I have 3 or I think 4 choices.
I
of different companies though, or just or plans?
Provider, but different plan options.
But is that a good thing, Randy? Like, that's what I mean. Like, is it fair?
Listen, I mean, I work in a company of roughly 50 people, and Sarah works in one of many times more. So she's got, multiple provider options, whereas I just have multiple plans under one provider. But I think the bigger question you're asking is, are there things that individuals should not have a choice in? And I think that that's a very valid school of thought to say that there are certain things that people should not be allowed to choose for themselves. But the point that needs to be brought up is that is a very marked difference from typical American policy in this area, and it needs to be treated as such, and I don't think that that's what it was. Ultimately, like what healthcare was reduced to is, when we look at the individual mandate component, is it's going to be a tax. And I don't think people were stepping back and saying, well, hey, what are we doing here? And what we're doing is really changing the way that we've ever looked at healthcare before and saying it's not an individual choice. It's actually something the government is going to mandate for you.
Right, but Randy, isn't there something to be said on the fact, Nancy Pelosi went on Meet the Press earlier and said, reminded us that...
Periwinkle pantsuit.
Okay, but she reminded the viewers in the sense that you're essentially paying for the free riders, right? I mean, don't you think that there's going to be a sense of...
Is ultimately this plan just a redistribution of assets and a redistribution of cost burden? Then great, then it's not really an accomplishment at all, and let's stop touting it as well.
Okay.
But how are you going to stop it? How are you going to stop the free riders without making it compulsory? Because the free riders are a problem.
It is.
Because, effectively on your health insurance, you're paying for them anyway. Your premiums are going up.
Right.
Because the more free riders there are, the more you've got to pay.
Part of what's gone on with this free rider problem is insurance companies have been raising their premiums over the past 6 months to maybe even a year in anticipation of a plan like this. They're responding to fear and responding to what's going to happen to their costs.
And they're the problem. They are our biggest enemy. They're everyone's enemy.
Well, so choose your enemy. Choose what do you want? What do you want to attack? Do you want to attack the free riders in the system? Because the truth is, how many times a year they go to the emergency room is so much less of a concern to me than just the space that they take up in Zuccotti Park, protesting the occupiers.
Do you know how many people do not have insurance and how the majority of people that hospitals treat do not have insurance, and the insurance companies are so wealthy.
It's obviously an election year. How do you guys think that this will affect the greater scheme of the election, both for President Obama and Governor Mitt Romney? Is this going to be a distraction from the economy and jobs, or is President Obama going to sort of continue to use it as part of his strategy to get reelected?
I think that ultimately people are going to vote in response to the pain that they feel at the time. And depending on how many measures from this plan can be put into place and actually felt by the people by the time November rolls around will really speak to the impact that it'll have on the election.
So the unemployment rate and jobs, you think, will play a major role?
That's still going to be the name of the game in my mind, and that's what's going to ultimately decide this election. I think that healthcare will be an interesting campaign strategy, and we'll see. Obviously, we'll hear a lot from Obama. This is not going to be the last we're going to hear from the administration about how great it is, and certainly not the last we'll hear from the Romney camp about, how horrible it is.
Right.
But ultimately, the people are not as clued in as we think they are, and what they're going to respond to come election day is the difference that they see.
Okay.
Well, I really hope that, the people who are enlightened and who do understand that with great your needs must come almost radical change, and understand that forefathers did not foresee this predicament when they were writing the Constitution. So I really hope that people don't get wrapped up in that and do understand that this is the kind of change that we have been promised and that we have been supporting our president for, and that he needs time. A lot of other changes will be made, and we just have to have faith in them.
Yeah,
I think that this will... Oh, go, Randy.
No, I was going to say, he's ultimately going to say that this is one of his biggest accomplishments, and the Romney camp is going to reduce the bill to saying, look, he's made healthcare a tax increase. He's increasing taxes. So depending on how people respond to those two principles.
I think that it will help Obama raise some cash, because it shows that, hey, the guy can get through legislation when he wants to, and that it can stand up. I think it'll help him get some money, which he desperately needs because Romney's got so much behind him. But I do think that it's not coming in for years. People aren't going to see the effect of it in their paycheck. I think that the jobs and economy is still going to be a far bigger issue because it plays on people's hearts and minds far more.
All right, great discussion, everyone.
At the end of the day,
Go ahead, Sarah. Closing thoughts.
It never ends.
I was gonna say, at the end of the day, if it's Obamacare versus Romney, I hope that there are enough smart enough people in this country to know that, to just realize that, Romney has nothing behind him.
Look at Randy smile. Look at Randy smile.
You gave her a headache. All right. On that note, thanks for weighing in. It was a great discussion, and we want to know what you guys think at home. So let us know on Twitter @Eruptin and check us out on eruptin.com. Thanks again, everyone.